Hello friends, today's video is about a query which one of the doctors have asked, Dr. Mulay. She asked one query regarding the retractile testes in adult. So I want to put few points regarding the conflict of retractile testes in adults. So first of all, uh, the development of the gonads, it starts at the 4th week of gestational life, as early as the 4th week of gestational life. So our testes, it descends from the posterior abdominal wall, it reaches to the inguinal ring and then the inguinal canal and to the scrotum, where the spermatogenesis and the all further process takes place. Why the testes has to be in the scrotum? Because it is the need of the spermatogenesis that there should be a proper temperature, and that temperature is set at a particular point, which is around 35 degrees. So this 35 degrees is 2 degrees less than our normal body temperature. So what happens is, if there is a fluctuation in the temperature, so the process of spermatogenesis is altered, it gets disturbed. So there is a set point, and for this set point the whole of the process of temperature regulation is required, and for this there is a role of cremaster muscle. So yes, the clinical entity of retractile testes is where the testes moves back and forth from scrotum to the groin. So this happens off and on. So why is this phenomena happening in the body? We need to understand this. The question which Dr. Mulay asked was, why is this phenomena happening and how to handle the cases which come with such complaints. So further, if we think, what is the actual phenomena happening in retractile testes is, the cremaster muscle is becoming hyperactive. Why is this cremaster muscle hyperactive? The cremaster muscle is hyperactive because it wants to pull the testes away. Why? Because either there is some kind of fear. Now I will come to the mind part. So when something is happening inside the body, there has to be some signal coming from the mind. So number one, there is fear, and fear is very important. Now what type of fear? Fear of losing something important. Okay. Why important? Because testes forms sperms, and sperms are very important for generation of future progeny. So the loss of something important is very important with respect to testes. So now, right or the left testicular half has different issues. Okay. So when the right testis is involved in retractile testes in a right-handed person, so there is fear of losing of business, or fear of losing some important power, fear of losing of some important status or position. Okay. Then there could be fear of losing a friend / fear of losing boyfriend. Mind you, fear of losing a person means the person need to be very important part of a of the patient's life. This is very, very important. Fear of losing friend, fear of losing boyfriend, girlfriend, fear of losing father. Okay, so these are the conflicts which are responsible for right-sided retractile testes in a right-handed male. When the right-handed male has left-sided retractile testes, it means there is a fear of losing his passion. What is passion? Passion could be anything. Passion could be his artistic aptitude. Passion could be his interest in. Passion could be his interest in sports. Passion could be his interest in any musical instrument. So that was taken away, or there is fear that that particular thing will be taken away. Okay. So these type of fears can cause left testicular retraction. Then fear of losing pet, if the pet is having any health issue and is about to die, or if someone else has suddenly snatched away the pet, or there is a fear that it will be given away to some other party. So those type of fears. So when there is fear of losing home, somebody is capturing the home, or because of some acute situation, the home which was very, very important for a person, so that home was the home was surrendered, and he had to sell the home. So this is very, very important. In another sense, losing home means if there are too much of interpersonal conflicts. So people are moving here and there. So one is going in this direction, another person is going in that direction. So that is also fear of losing home. So that also can cause fear of losing mother. If the mother is having health issues and because of any reason the mother wants to move away from children. So this is another conflict. Then fear of losing brother or sister. Likewise. So all these things, they will cause retractile testes. And the same fear, if experienced by a pregnant mother, it can cause retractile testes in infants and children. So the fear of losing some very, very important thing or person in life is the conflict for retractile testes. So Dr. Mulai, I hope I was able to answer your query in a very nice way. And friends, I thank you all for supporting me in my daily video tip series. I hope that more and more doctors and practitioners join and subscribe my channel. Thank you again. Thank you one and all. And it's been a pleasure that I completed 1K subscriber. So thank you all.